Hello everyone, welcome to Wellness Wardrobe. Hope all are doing good. Today let's talk about male genital aspect. That is, balanitis. At first let's understand, what is balanitis? Balanitis is an inflammation of the end of the penis. It can occur at any age. Often the foreskin is also inflamed at the same time as the glands. The foreskin is the loose skin that covers the glands if you have not been circumcised. Balanitis is common, and it can occur at any age. It more commonly affects boys aged under 4 years and also men who have not been circumcised. About 1 in 25 boys and about 1 in 30 uncircumcised men are affected with balanitis at some time in their life. It is very uncommon in men who have been circumcised. Now let us know, what are the symptoms of balanitis? The most common symptoms include redness, irritation, and soreness of the end of the penis. It can range from a small patch of redness confined to part of the skin surface of the glands, to the whole glands becoming red, swollen, and painful. Sometimes there is a thick, clumpy discharge which comes from under the foreskin. It may be impossible to pull the foreskin back. You may also have pain or discomfort when passing urine. Now let us understand the causes of balanitis. Mainly there are 5 different causes of balanitis. They are 1. Poor hygiene. 2. Infection, not sexually transmitted. 3. Infection, sexually transmitted. 4. Allergy and irritants. 5. Skin conditions. Now let us discuss about poor hygiene. Poor hygiene around this area, combined with a tight foreskin, can lead to irritation by smegma. Smegma is a cheesy-like substance which forms under the foreskin if the end of the penis under the foreskin is not clean. This is the most common cause of balanitis. Number 2. Infection, not sexually transmitted. Various germs that live on the skin in small numbers may multiply and cause infection. A common cause of infection is with a yeast called Candida. Candida is the same germ that causes vaginal thrush in women. Small numbers of Candida commonly live on the skin and can sometimes cause infection. Some types of bacteria are also a common cause of balanitis. Any man or boy can develop an infection. However, an infection of the glands is more likely to develop if you already have some inflammation of the penis due to an allergy or irritant, have diabetes. In particular, if your diabetes is not well controlled and the urine contains sugar. After going to the toilet, drops of urine which contain sugar may remain behind the foreskin and allow germs to multiply easily. Have a phimosis. This is a condition where the foreskin does not pull back over the glands. This is common in young boys. After the age of 5 years, the foreskin will usually retract easily so the glands can be gently cleaned. You are more likely to get a balanitis if you have a phimosis, as sweat, debris, and urine may collect under the foreskin. This can irritate directly or can encourage bacteria to thrive and cause infection. Number 3. Infection, sexually transmitted. Some sexually transmitted infections can occasionally cause balanitis. In particular, an STI is more likely if you also have inflammation of the tube that passes out urine. Various STIs can cause a urethritis and a balanitis. For example, genital herpes, chlamydia, and gonorrhea. Symptoms of urethritis include pain when you pass urine and a discharge that comes from the urethra. Number 4. Allergy and irritants. The skin of the glands is sensitive. It may react and become inflamed if it comes into contact with various chemicals or other substances. For example, if you do not wash under your foreskin, old skin, urine, sweat, and other debris can collect there. This may irritate the glands and may lead to inflammation. Certain soaps and disinfectants that you may use to clean the penis. Overwashing or scrubbing may also irritate the delicate skin of the glands. Condoms, spermicides, the lubricant in condoms, and lubricants used when having sex can all irritate the glands. Chemicals spilt on your hands may be transferred to the penis when you go to the toilet. Some washing powders or fabric conditioners that are not rinsed well from underpants. Number 5. Skin conditions. Certain skin conditions may cause a balanitis or be mistaken for a balanitis. For example, psoriasis and some uncommon skin conditions can affect the penis. Now let us see how balanitis is diagnosed. A doctor can easily diagnose balanitis by the red and inflamed look of the end of the penis. In some cases, the likely cause can be determined by the look of the inflammation. For example, the inflammation caused by Candida often looks quite typical. So, in certain cases, your doctor is able to diagnose the cause and advise on treatment straight away. If your doctor is not sure about the cause, or the balanitis does not clear with treatment, one or more of the following tests may be suggested. Number 1. A swab to look for certain germs that can cause infection. Number 2. A test to check for diabetes if this is suspected. Number 3. Referral to a genitourinary medicine clinic if an STI is a suspected cause. Number 4. Referral to a skin specialist if a skin condition or allergy is thought to be the cause. Allergy testing may be advised if an allergy is suspected. Number 5. Rarely, if the inflammation persists, a small sample of inflamed skin may be taken to be looked at under the microscope. This can help define the cause. Now let us see what are the treatments for balanitis. The following treatments are recommended if you have balanitis, regardless of the cause. Number 1. Avoid soaps when inflammation is present. You can use a moisturizing cream or ointment to clean instead of soap. Number 2. Use lukewarm water to clean your penis and then dry gently. Number 3. Some people find that salt baths are soothing whilst treatment takes effect. The treatment depends on the cause of the balanitis. The following are often given. An anti-yeast cream or a course of anti-yeast tablets is a common treatment if the balanitis is caused by candida. Antibiotics will clear infection caused by germs, including certain STIs. A mild steroid cream to reduce inflammation is useful for balanitis caused by allergies or irritants. Sometimes a steroid cream is used in addition to anti-yeast or antibiotic medication to reduce inflammation caused by infection. But note that, if there is infection at the end of the penis, then a steroid cream should not be used alone, as steroids can make infection worse. If you have recurring balanitis and have a phimosis a condition where the foreskin does not pull back over the glands, then an option is to be circumcised to remove the foreskin. If this is the case, then your doctor will refer you to a doctor who is a specialist to discuss this in more detail. Now we have a question: can balanitis be prevented? The answer is yes. There are some tips which may help to prevent some cases of balanitis, and it include: wash the end of the penis each day. Pull the foreskin back gently whilst in the bath or shower. Then gently clean the glands using just water or water and a bland soap. Make sure the penis including the glands is dry before you put on underpants. If symptoms are related to condom use, try using a condom which is designed for sensitive skin. Wash your hands before going to the toilet if you work with chemicals which can irritate delicate skin. Use a condom each and every time you have sex with a new sexual partner. So, that's all for today. Thank you so much for watching. Stay safe, stay healthy, and spread the message.